I'm Dr. Manuel Astruc. I'm a board-certified psychiatrist. I help entrepreneurs who are suffering from depression get back to being energetic, productive, and very confident. What does off-label mean? And let me take you back to medical school. So back in 1988, I was in my third year of med school. And at that time, the antidepressants that were available were what we call the tricyclic antidepressants. So those are medicines that have been around for a long time. They're very effective. They have a lot of side effects and a lot of problems associated with them. And suddenly in 1988, Prozac, fluoxetine, was approved by the FDA as a new antidepressant that was an SSRI, a selective serotonin reuptake inhibitor. It was a game changer for antidepressants, but it was used on label for depression. And subsequently, afterwards, there was a whole clone, a whole set of SSRIs that came out. So Zoloft or sertraline, Paxil, paroxetine, escitalopram, Lexapro, Celexa. A whole bunch of these medications came out. And one of the things that we found as we were using these medications, so in a couple of years, 1980, I was now a resident in psychiatry, and we found that these medications were also very effective for anxiety conditions. And we started to use them for generalized anxiety disorder, for panic disorder, and for obsessive compulsive disorder, which are all anxiety conditions. When we were doing that, it was an off-label use, because the medicines had shown up and had been FDA approved for depression, but once a medicine is approved by the FDA, there's no rule that says that you can only use it for that one bucket that it's been approved for. And since we had found that it was so effective for these other disorders, we were using them off-label. Now, one of the things that will happen in the pharmaceutical industry is that if we're using something off-label and a medication manufacturer decides that they want to invest some money into the studies to then show the FDA, you know what, Prozac is also effective for generalized anxiety disorder or for obsessive compulsive disorder. If they present additional information to the FDA, they can in fact be approved for this additional, what they call, indication. There are a lot of medications that we use that are used off-label, and the company that has that medication as one of their meds has never gone to the trouble of getting it approved as an additional off-label use to make it a on-label use. So let me give you some examples. Like, one of the first medications that was found to have additional benefits was isoniazid. It was an MAOI inhibitor that was used for tuberculosis, and they found that all these patients in tuberculosis sanatoriums were happy. They had these classic pictures of them smiling in these day rooms and dining rooms and just laughing. And we found out it was the first antidepressant that was found fortuitously as an off-label use. It did ultimately get turned into a medication that was labeled and indicated for depression, but it didn't start off that way. Another medication that has been used in a lot of different ways is a medicine called amitriptyline. Amitriptyline is one of the older tricyclic antidepressants, and therapeutic doses of amitriptyline are like 300 milligrams. But we found that at very low doses, so we're talking 10 milligrams, 25 milligrams, 50 milligrams, it's very effective for nerve pain, neuropathies, and for migraine headaches. So it's a very common medicine that is used off-label for conditions in a way that have been very well validated in the field, but have not been shown to the FDA to be effective. So they do not have the official designation as, being indicated for either migraines or neuropathy. Another common medicine that we use, Topamax or topiramate. Topiramate is an anticonvulsant, and we use it in psychiatry for a number of different things. It's used very commonly for nerve pain, for migraines, and we take advantage of one of its side effects. It makes people lose their appetite. And a lot of our psychiatric medications crank up people's appetites. No one wants to go on a medication that makes them gain weight. So we'll sometimes add Topamax on as an additional medication off-label, trying to take advantage of the fact that it helps people to lose their appetite and not gain weight or lose weight after they've gained it with a medication. Now, there's one more group of medications that is very frequently used for a lot of different reasons. When I was growing up as a psychiatrist, as a resident in training, when we were working with bipolar disorder, people who had mania, there were only a handful of medications that we had available with us to help these patients. And these medicines were like lithium, Tegretol, which is carbamazepine, or Depakote. That was it. That was all we had to treat bipolar disorder with. But we had found that people who were manic also responded to antipsychotics. And back in those days, we had medicines like Haldol, Navain, Prolixin, and because when people get manic, they can lose touch with reality. Not everybody does, but they can. We would use the antipsychotics, and we found that, lo and behold, it would help mania. So even though there were only a handful of medications that were really officially designated as medicines to be used for mania, we were using the antipsychotics frequently as add-ons to help our patients who had bipolar disorder. Years down the road, a series of antipsychotics came out that were called the atypical antipsychotics. And we, of course, knew that the antipsychotics helped with mania, so we tried these medicines that came out and were indicated just for schizophrenia with mania. And we found a number of different things as we were using them. Number one was that they were very effective with mania. Number two was that they were also incredibly effective, some of them, not all of them, with the depressed end of bipolar disorder, which we had not really known about. And ultimately, some of them went to the FDA with studies to get approvals and indications for bipolar disorder depressed type. But the data first came when we were using it off-label. Now, the reason that this is important is because with transcranial magnetic stimulation, and I'll talk about this some more, but some of the ways that I think this modality can be useful. It's indicated for major depressive disorder that has failed to respond to one medication. But I think that there's places where TMS can be effective and can be used off-label in a way that's incredibly safe. So when we're looking for off-label indications for something, using a medication or a treatment modality, safety first and effectiveness. One more medicine that we will commonly use, and I remember finding this, it was probably 15, 16 years ago. In post-traumatic stress disorder, one of the common, very disturbing symptoms for people are that they get nightmares of their trauma, like night after night. It disrupts their sleep, and makes folks incredibly distressed. It's one of the symptoms that causes a significant amount of distress for people with trauma. And historically, there's nothing that we've been able to offer patients for nightmares. There's just not a good medicine for that. I remember when I was in my residency, we did a rotation through the VA. Half my residency was in the Medical College of Virginia, in the hospital in that system, but the other half was working at the VA, which was a couple miles away, and half the residency program was spent working with the veteran population, and there was just a lot of PTSD in that population, as you can imagine, and we didn't have anything to help with that. But lo and behold, there's a blood pressure medication. The brand name is Minipress. The generic name is Prazosin. And at very low doses, we found that it's very effective at knocking out people's nightmares. Who knew? Well, we found that out fortuitously, and now it's one of the common things that we're able to provide and to help our patients with who are having horrible nightmares night after night. That makes it so that literally people don't want to go to bed.